Pediatric Transportation and Emergency Safety Training PPEC Dr. J.G. Padin MPH-Consultant. Participants will develop the knowledge and skills necessary to recognize emergencies, perform CPR, administer first aid, and ensure safe transportation practices for all children in their care. In the event of an emergency, staff will ensure scene safety, assess the child's condition, activate EMS when necessary, provide appropriate care within their scope of training, and complete all required incident documentation in accordance with facility policies and procedures. Staff will be trained to recognize early signs of a medical emergency, promptly activate emergency medical services, EMS, initiate CPR when indicated, utilize an automated external defibrillator, AED, as appropriate, and support advanced medical care until emergency responders assume responsibility. Staff will provide emergency care using current American Heart Association, AHA, guidelines and age-appropriate techniques to ensure safe, effective, and developmentally appropriate interventions for infants, children, and adolescents. When performing infant CPR, first check for responsiveness by gently tapping the infant's foot and shouting. If the infant is unresponsive and not breathing normally, activate the emergency response system and begin CPR. Deliver 30 chest compressions followed by 2 rescue breaths using the 2-finger technique, placing 2 fingers in the center of the chest just below the nipple line. Continue cycles of 30 compressions and 2 breaths until advanced medical assistance arrives or the infant shows signs of recovery. CPR on a child. First assess responsiveness and breathing. If the child is unresponsive and not breathing normally, activate the emergency response system and begin CPR. Deliver chest compressions at a depth of at least 1/3 of the chest's anterior-posterior diameter, approximately 2 inches or 5 centimeters, at an appropriate rate. After 30 compressions, provide 2 rescue breaths, ensuring visible chest rise with each breath. Continue cycles of compressions and rescue breaths until emergency medical personnel arrive or the child regains responsiveness.
Pida ayuda ahora. Retire toda ropa del pecho del paciente. Tire de las arrojas para abrir la bolsa. Observe las figuras en los electrodos. Desprenda el plástico azul de un electrodo. Coloque el electrodo en la piel desnuda, como se muestra en la figura. Presione firmemente el electrodo, evaluando la frecuencia cardíaca. Preparando descarga. Manténganse alejados. Pulse el botón que parpadea. Descarga administrada. Inicie RCP.
An AED is a device used to help restore a normal heart rhythm during sudden cardiac arrest. Staff must know the location of the AED and be able to access it quickly in an emergency. Use pediatric pads when available and follow the AED's voice prompts for proper pad placement and use. Continue CPR and follow AED instructions until EMS arrives or the child recovers. Must watch the video. First aid begins by protecting the child, yourself, and others from further harm. Next, assess the child's condition to identify any injuries or medical concerns. Provide appropriate treatment based on the child's needs and within your level of training. Continue to monitor the child's condition until emergency medical services arrive or the child has recovered. To control bleeding in a child, first ensure the scene is safe and put on gloves if available. Apply firm, direct pressure to the wound using a clean cloth, gauze, or dressing. Maintain continuous pressure until the bleeding slows or stops. If blood soaks through the dressing, do not remove it. Instead, place additional dressings on top and continue applying pressure. Elevate the injured area above the level of the heart when possible and if no fracture is suspected. Monitor the child for signs of shock, such as pale skin, rapid breathing, weakness, or decreased responsiveness. Seek emergency medical assistance for severe bleeding, deep wounds, uncontrolled bleeding, or if the child shows signs of shock. Remove the child from the source of the burn and cool the affected area with cool running water for 10 to 20 minutes. Cover the burn with a clean, dry dressing. Do not apply ice, creams, or ointments. Monitor the child and seek medical attention for severe, large, or blistering burns. Staff must recognize the signs of anaphylaxis, including difficulty breathing, swelling, and hives, and activate EMS immediately. Prohibited foods identified by the PPEC Center's allergy policies must not be brought into or served in the facility to ensure child safety. Staff must recognize the signs of choking, including inability to speak or cry, difficulty breathing, weak or absent cough, and bluish skin or lips. Immediate intervention is required to prevent a life-threatening airway obstruction. For a choking infant, provide 5 back blows followed by 5 chest thrusts until the object is expelled or the infant becomes unresponsive. Activate EMS and begin CPR if the infant loses consciousness. If a child experiences a seizure during transportation, safely stop the vehicle and protect the child from injury. Do not restrain the child or place anything in the child's mouth. Document the seizure duration, symptoms observed, and interventions provided. Notify the Center Director of Nursing, DON, immediately and follow all instructions. If the DON cannot be reached, call 911 for emergency assistance. Children must be transported using the appropriate car seat based on their age, weight, and height. Rear-facing seats should be used for infants and young toddlers, forward-facing seats for older children who meet safety requirements, and booster seats until the vehicle seat belt fits properly. Seat belts must be worn at all times during transportation. Before transportation, staff must verify that the car seat is securely installed, the harness fits properly, and the chest clip is positioned correctly. Children must be properly restrained at all times. If a child refuses to wear the seat belt or car seat harness, or if the restraint system is malfunctioning, the child may not be transported. Staff will attempt to identify a safe alternative. If one is not available, the parent or legal guardian will be contacted to pick up the child. During bus transportation, children must be under constant supervision and remain properly restrained at all times. Wheelchairs and adaptive equipment must be securely fastened and occupants properly positioned and secured before transport. Staff must be familiar with emergency evacuation procedures and prepared to safely evacuate all children if necessary. Staff must be trained in rapid and safe evacuation procedures to ensure the timely removal of all children during an emergency. Evacuation plans should be followed, and children must be safely accounted for and supervised throughout the process. Important notice: read carefully. This is a mandatory training session focused on patient safety and emergency preparedness. All staff are responsible for the safety and well-being of the children in our care and are accountable for their actions and decisions. Questions or concerns should be directed to the PPEC Director of Nursing. Patient safety is everyone's responsibility, and most accidents can be prevented through vigilance, adherence to policies, effective communication, and timely intervention.